Hey, so what's up? So one of the biggest things right now that is just taking the world by storm, we're doing it in the office, we're actually worked extremely well, is some of the GLP agonist medications out there. One of which is semaglutide, or you may have heard of Ozempic or whatever, right? So this stuff works, but you have to make sure you're not just buying this stuff from some random and they're not taking care of you, because there are a lot of potential downfalls and pitfalls with this that can come back and bite you in the butt. And in a year or 2 years or however long, you're going to be basically have lost a bunch of weight, gained it all back. And when you gain it all back, you're actually gaining nothing but fat back and have lost a lot of muscle. So how do you do this? Pay attention. I'm going to go quick. Okay. So this isn't long. One, nutrient support. You have to support the nutrients. If you are on a caloric and a food restricted diet, or you just don't feel like eating, you have to make sure your body still gets nutrients or you will get sick. So having nutrient support pack, something that's going to support your liver and your gastrointestinal system. So motility, gut motility, because constipation is one thing that we're seeing very prevalent with this type of program. Okay, so make sure you're supporting that. Second, hydration. Make sure you're drinking water. A lot of times when we're not hungry, we don't drink water either, and then we become dehydrated and we have a whole other host of issues. Make sure you're drinking half your ounces or half your body weight in ounces of water every day. Okay. Let's see. Number 3, muscle support and exercise. Like I said, you're going to lose potentially, what they're seeing in the studies is you're actually going to lose up to, or some of the people that were doing this, losing over 50% of the weight that they're losing was muscle mass. So what can you do to prevent this? One, you have to take a plethora of protein and amino acids. Or in your diet, make sure you're eating a lot of protein, healthy proteins, right? You've got to make sure you're doing this. This is not something that you can, because again, if you're losing 100 pounds and 50 of that is muscle, if you ever start to gain that back, you may gain 100 pounds back and have all that muscle gone, right? So we don't want that to happen. So we want you to keep and maintain that muscle as you drop weight. Right? So then you're only losing fat or mostly fat, right? So make sure you're taking the proper amount of amino acids and protein for you and your body type and your size, right? Number 4, chemistry maintenance. What does this mean? As you're on a diet like this and it's caloric restricted, it's going to potentially affect other organ systems. So you need to make sure that you're watching these other organ systems. Also, to your hormones, if your hormones aren't dialed in, it may make it more difficult for these types of medications to work. So look at your thyroid, look at your testosterone. Those type of things can help to support muscle maintenance and help to support weight loss. So you should be looking at these if you're doing this type of program. It's going to give you success. It's also going to give you success on the back end, which is number 5, post-medical or post-medicine support. So if you're taking these medicines, what are you going to do when you get off of them? What kind of program are you going to be? Have you set good habits in place with protein, amino acid intake to help support that metabolism and that muscle mass maintenance, et cetera, keeping you full. Also, too, you're going to go from not ever wanting to eat to wanting to eat again. So what are some things that your providers or the people that are getting you this stuff, hopefully it's through a medical practice somewhere out there. I know our nurse practitioner is phenomenal with this, and she makes sure, at least to the best of her ability, to make sure you're supported on this. There are options. There are at least a few different options that can be done, and which can help to prevent that rebound, which so many people are seeing. God bless. Have an awesome day. If you're doing these type of things or you want to lose weight, obviously find somebody that knows what they're doing, somebody that's going to support you through this and not just sling it to you and tell you to do whatever you want, because there's going to be some repercussions to that. So do it right, and good luck.